Good afternoon. Welcome. I'm Raysa Rodriguez, Chief Program and Policy Officer at FPWA. We're excited to have you join us today to learn about Federal Funds Tracker at FPWA and ensuring financial stability for human services. A little bit about our agenda that we'll walk through today. We'll spend some time introducing FPWA's Federal Funds Tracker, taking a look at the history of this tool and some of the key takeaways that we've learned throughout the years. Then we'll turn to a bit of a deeper dive into federal funding for New York City's human services in fiscal year 2021. And then we'll take a look ahead at the implications of this data for city, state, and federal level budgets. I'll have you note that we have enabled a Q&A function on this chat, and so on the Zoom rather, and we encourage you to include any questions you have during our presentation in the Q&A section of the Zoom. Before we get started, a little bit about FPWA. For 100 years, FPWA has served its member agencies and partners. We are an anti-poverty policy and advocacy organization that promotes economic opportunity and a strong human services sector. We do this through critical capacity building supports to member partners, nonprofit leaders, faith leaders, and the sector at large, and by conducting critical program advocacy and policy research. As the city begins to recover from COVID, we find it ever more important to spot a light on human services and the important role human services partners play in supporting the communities that are hardest hit by the pandemic. We've designed a series of May sessions to address the stress facing the sector with discussions on ensuring financial stability, which we'll cover today, and other critical points to ensure recovery for the sector as a whole. I'll introduce briefly our Director of Programs, Audia Lanatz, who can walk us through a broad top-side messaging for our sessions ahead.
Thank you, Raysa. I'm Audia, the Director of Programs here at FPWA. As Raysa said, we're really pleased to introduce and start a three-part series in May around leadership and recovery, especially in the human services organizations during COVID-19. So today is the first session, the Ensuring Financial Stability for Human Service Organizations. Next week on May 12th, we'll be having the second part, Leading and Managing Through Change, supporting your workforce at this stage of the pandemic. And that will be presented by a guest presenter, Jen Curry, who's the founder and CEO of an organization called Change Impact. And then finally, we'll close out the series on May 24th with part 3, which is building a culture of community care, really prioritizing employee well-being during this time. And that will also be a guest presenter, Dr. Wenemo Okoya, who is the founder and leader of Healing Schools Project, as well as the new director of Center of Strategic Partnerships and Solutions at NYU Metro Center. So please join us for all three parts if you can. It's hopefully a very helpful and exciting series.
Thank you, Audia. So let's get started. A little bit about the Federal Funds Tracker at FPWA. We launched this tool in 2016 during a very different landscape at the federal level in response to growing concerns about human services potential cuts in federal funding. The tool provides member organizations and the sector as a whole with accessible information on funding trends for critical human services programs. It also allows FPWA to conduct fiscal analysis at the federal level and report on local implications for federal legislation. A little bit more about the capabilities of the Federal Funds Tracker. It tracks federal funding, as I mentioned, for 8 New York City human services agencies, which you'll hear more in a bit about the 8 agencies, and tracks fundings for these agencies between 2010 and 2021. Funding is available, data is on funding is available at the individual grant level and on the program level as well. In addition, the Federal Budget Analyzer tracks federal funding received by FPWA member organizations and how funding would change under federal changes legislated under different legislative proposals, I should say. Next slide, please. So a bit of a snapshot of what we've learned to date. Some key points in terms of the history of that we've been able to track with this data. The federal funds tracker found significant reductions in federal funding for New York City's human services between 2010 and 2019, largely the result of fiscal austerity beginning in 2021. During this period, ACS took the hardest hit in funding cuts, with deepest implications for the adoption assistance and the Child Care Development Block Grant. During the former administration at the federal level, the federal funds tracker consistently found that the administration budget proposals would result in sharp cuts to human services, while the budgets ultimately passed by Congress resulted in roughly flat funding for human services. We find this data important for our ongoing advocacy efforts at FPWA and greatly informs our legislative and policy strategies at state and federal levels. With that, I'll turn it to our senior fiscal policy analyst, Andrew Perry, who will walk us through some of the critical data that we have found for this most recent year in federal funding. Andrew?
All right. Yeah, terrific. Thank you, Raysa and Audia, for putting this on. I'm excited to present these findings. So what we're going to focus on today is I'm going to give an overview of the findings from the Federal Funds Tracker's most recent research, which was a report we published about 2 months ago that on funding for New York City Human Services during 2021. And then at the end, we will look ahead to what the policymakers have in store for us in their 2023 budgets at the city, state, and federal level. So it's important to note here that when we say 2021 throughout the presentation, I'm talking about the city's fiscal year 2021, which started in July 1st, 2020, and extends through to July 30th of 2021. So when you consider that time frame, it's going to be no surprise that federal funding is really dominated by the federal response to the COVID-19 pandemic. So in a series of relief bills, including the CARES Act and more recently the American Rescue Plan, Congress appropriated really unprecedented sums of money, through to both households directly, businesses, and then also for local governments to respond to the pandemic directly and to try to make up for some of the economic fallout that's caused by the pandemic. And the Federal Funds Tracker finds this quite clearly in record high funding for human services during 2021. All in, the 8 agencies that are tracked by the Federal Funds Tracker took in $5.3 billion in federal funding, and this is a 22.7% increase from the prior year. So on the headline, it seems like, okay, perfect, the COVID relief is really doing its job. And certainly the COVID relief did help, make up for pretty acute economic, health, and social needs that were caused by the pandemic. But what we wanted to do with the Federal Funds Tracker is dig a little bit deeper and find out what's going on beneath the surface. And when we did that, we find that just 2 programs account for the total federal funding increase in human services, meaning that without those 2 programs, you would have seen actually no increase at all. And then if we look a little bit more broadly at 6 programs that made up the lion's share of federal COVID relief, and without those programs, federal human services funding would have actually fallen 5.7% from last year. So this presents pretty substantial risks going forward if baseline federal funding continues to decline as the sort of extraordinary appropriations made during the COVID emergency begin to expire over the next couple of years. And this risk is really sort of encompassed by TANF, which sort of led the decline in human services funding. So I will get to each of these points sort of in turn, looking at them in more detail before we move on to looking at the budgets ahead on the next slide. So the federal funds tracker follows federal funding back to 2010. 2010 was really the high watermark for federal funding that was disbursed as part of the stimulus passed after the 2008 recession, the stimulus passed by President Obama. And since 2010, the federal funds tracker has tended to find sort of stagnant or declining federal funding for human services after adjusting for inflation. So that's what made last year so unprecedented. We really saw an enormous spike in funding, a 22% increase, about $1 billion increase from the prior year, which is totally unprecedented. So where did this money go? We can see on the next slide, the answer is mostly healthcare. Unsurprisingly, DOHMH took in a pretty significant majority of that $1 billion total increase in human services funding. Their budget tripled to $1.1 billion in just 1 year. And then the other agency that really gained a lot of money from the COVID relief was the Department of Homeless Services, which saw its budget rise 29%. DSS is always the largest recipient of federal funding. Their budget was roughly stable. They saw a 3% increase from last year. And then two agencies actually saw their federal funding fall in 2021. And those were the Administration for Children's Services and the Department for the Aging. Next slide. Yeah. So you know, looking at agencies is one way that the federal funds tracker could try to provide more insight to what's going on, and the other way is to look at individual grant programs. So here we can see the top 10 grant programs distributed citywide. So of course, federal funding can be administered across agencies. So as is the case in TANF, most of it's distributed through DSS, but other agencies have TANF programs as well. And here we see those two programs I mentioned earlier that really made up the vast majority of all of the COVID relief funding. The first is epidemiology and laboratory capacity for infectious diseases. This program is administered solely by DOHMH. It actually existed before COVID, but it was a fairly small and obscure federal grant that we didn't really pay much attention to. And then it was used as sort of the primary vehicle for delivering that direct funding down to the local level that really allowed the city to do all of the immediate response to the COVID pandemic. So all of the testing and tracing and the COVID monitoring, all of that was run through this program. So no surprise that they saw a massive increase from a relatively small budget to taking in about $850 million last year. And then the other program that really saw an enormous increase in funding was the Emergency Shelter Grant Program. So the Emergency Shelter Grant Program, again, very, very limited federal funding historically, although it did exist before. It wasn't created by the CARES Act, but it was used by the CARES Act to address these acute needs that popped up to get people out of congregate shelters and to deal with the housing emergency. And that rose to almost $250 million last year. And that is what's responsible for that increase we saw on the last slide in DHS's total federal funding. So those are the two programs I mentioned at the outset as taking in the most federal funding, this sort of analysis also lets us identify the other programs that really benefited directly from COVID relief bills. And those were the Section 8 housing vouchers, Medicaid, the Social Services Block Grant, and then one that is not in the top 10, but still received a substantial increase in federal funding, which is the Community Services Block Grant. So these are the 6 programs that I mentioned sort of all together as having taken in the vast majority of all of the federal COVID relief. And without these, which means, you know, if not if they disappeared, but if funding for these programs had simply kept pace with inflation and not benefited from this emergency COVID funding, we would have actually seen federal funding for all of the other, you know, hundreds of federal grant programs that are handed down from the federal government to city agencies every year, that funding would have fallen by 5.7% last year. And you can see some of them among these top 10 federal grant programs, including TANF and Child Care and Development Block Grant, SNAP, and foster care services, which did not receive supplemental appropriations in any of the federal COVID relief legislation. The biggest one of these is always TANF, which we can take a closer look at the next slide. We'll see that TANF, this is actually the third consecutive year that TANF has seen declining federal funding. And the $1.5 billion that TANF received from the federal government last year is the lowest level after adjusting for inflation since 2011. And it's fully 19% below its fiscal year 2018 level. It's important to note that this is driven not by decreases in TANF caseloads. TANF caseloads actually rose during the pandemic, but by how New York State TANF rules intersect with the federal appropriations formulas. And because this program is so critical and it's such a central part of our sort of human services system, the FPWA policy team is really going to be taking a deeper look into this, both looking at the federal gaps or the federal funding gaps and at the financial gaps that are associated with how the program is designed. So I would simply advise our listeners to keep an eye out for more policy and advocacy work that will be coming out of our team on TANF in the months ahead. And the losses to this program really underscore the risks that we run once the COVID relief money starts to expire. If the existing human services programs are seeing declining funding, as those programs expire and return to normal levels, we may see lower aggregate federal funding for human services at a time when the need is still elevated. And so we'll, on the next slide, to underscore or to really describe how these risks work and how this works in practice, we actually reached back to the experience of the last recession. So in the aftermath of the 2008 financial crisis, Congress passed a series of bills. The bills were initially aimed at shoring up the financial sector. And then when President Obama was inaugurated in January 2009, his first priority was to pass a broader based stimulus, the American Relief and Reinvestment Act, which was passed in early 2009. And that was to try to kickstart the recovery and try to restore employment back to levels after they'd taken this sort of unprecedented hit from the 2008 recession. Now, there's a broad consensus that the amount of money appropriated in that bill was too small. And as a result of that, while funding did kickstart a recovery and employment did start to fall, unemployment did start to fall as the funds associated with that bill were started to be dispersed. The recovery was slow and inequitable. And to make this point, it's instructive to look not just at the unemployment numbers overall, but to look at sort of the dynamics and dimensions of those unemployment numbers. So nationally as a whole, unemployment peaked in late 2009 and then began this sort of slow, steady descent. And it was slower than other recoveries to past recessions. If you look at communities that were harder hit, including communities with lower average incomes, we see a pretty different trajectory. So our team wrote an op-ed in the Gotham Gazette where we showed some of these numbers. In the Bronx, to use an example, unemployment rose to a higher level than the national average. And while unemployment in the Bronx did start to fall as those stimulus funds started to be dispersed in 2009 and 2010, as the federal government pulled back funding in 2011, unemployment actually started to rise again in the Bronx. And it rose to almost the same level that it reached in the immediate aftermath of the 2008 recession. So fully in 2012, unemployment in the Bronx was at the same level that it was at in early 2009, which is a pretty staggering reversal. And it wasn't until the year later that unemployment started to fall again. So communities that were the hardest hit actually saw this sort of double dip recession that lasted for fully 5 years, which I think many in the audience understand how devastating an economic toll this is. If you look at the unemployment rates for white workers and compare them to the unemployment rate for Black workers, we actually see the same trajectory where white workers see this sort of slow, steady decrease in unemployment, whereas for Black workers, as the federal government pulls back investment in 2010, we see unemployment rates return to all-time highs and stay elevated. So this was a devastating and inequitable economic recovery. It seemed initially during COVID that federal policymakers, to some extent, learned their level. They mounted a response that was, in real terms, far greater than the response to the 2008 recession. Just in sheer sort of percentage of the GDP, we're talking a lot more money, and that did seem to kickstart a faster recovery. So far, unemployment has fallen faster than it did after 2008. Although, like 2008, it was communities that already, tended to have lower average incomes, and communities of color still see higher unemployment. And New York City has much higher unemployment than the U.S. as a whole. One risk that we're highlighting is that while they got things right the first time by going big rather than going too small, federal funding may expire too early while the recovery is still relatively nascent. Even when we wrote the paper a couple of months ago, it looked like the recovery was moving along pretty nicely. Already we're seeing global macroeconomic headwinds that have nothing to do with, largely are unrelated to goings on in the United States that are slowing down the recovery. And this is coming as federal funding is already starting to pull back. At the same time, caseloads for public assistance, including Medicaid and TANF, rose during COVID, and they remain persistently high. So as federal funding begins to pull back, this poses a potential, liability for local governments, which will have to, either reallocate resources or raise revenues to cover higher caseloads, or, at worst case, pare back benefits. All of these things sort of reinforce themselves and risk having a recovery that like 2008 is slow, inequitable, and imposes an enormous toll on the communities that were hit the hardest by the original sort of economic, health, and social impact of the pandemic. So the response to this is, the federal funds tracker is going to be monitoring where there are funding gaps, where there are funding cuts in different human services programs. And it's really up to all levels of government to be vigilant and look for ways to fill in gaps and raise revenues or reallocate resources to fill in gaps for critical services that are currently doing the work of supporting hard-hit communities, as those gaps begin to materialize over the next couple of years. So with that being said, we can now look ahead to what our policymakers at all three levels of government have in store for us with their 2023 budgets. So we'll start with New York State because they've already passed their budget. Their budget came in about a week late on April 9th. And the big pot of money for human services is really all around childcare. Childcare was sort of the big human services push for this year. And where they ended was a $5 billion package over 3 years to expand eligibility for childcare services that are funded by that federal block grant. The way this spends the money is by raising eligibility to 300% of the federal poverty level. So if you make, within 3 times the federal poverty level, you are now eligible for subsidized childcare program, childcare. And then there's a couple of other sort of smaller mechanisms through which they expand eligibility for childcare, as well as tax credits for families, and an additional tax credit for that childcare providers based in New York City can take against New York City taxes. So there's sort of some support on the childcare provider side, and then more support just by raising that eligibility for low and moderate income families to receive subsidized childcare. This was a compromise with more extensive proposals put forth by the State Senate and the Assembly. So the Senate wanted to spend $4 billion to raise eligibility to 5 times the federal poverty level, and the Assembly wanted to raise eligibility just a little bit less, 4 times the federal poverty level. And then those in turn were compromises with the most ambitious proposal that was put up by State Senator Brisport, which would have been a $9 billion package to provide truly universal childcare. So doing away with the means testing altogether and allowing anybody to take advantage of subsidized childcare. So that was the big push. There were other human services items that we've highlighted here, including a 9.4% cost of living adjustment for human services worker during fiscal year 23. And then pretty substantial investments in the healthcare workforce. There's a couple of new workforce development programs to try to bring workers into the industry and train workers into the industry, as well as bonus pay for healthcare workers. There's also a minimum wage increase for home health aides, which was another compromise where I think what was ultimately delivered is substantially less than what advocates were going for. They still got an increase in the budget. We'll move ahead to look at New York City. So New York City, the mayor last week released his executive budget proposal. Here already we're seeing some of the risks that I highlighted earlier, where the top line budget is actually smaller than it was last year. The overall city budget comes in at $99 billion for fiscal year 2023, which is lower than the $108 billion budget for fiscal year 22. This is exclusively because of falling federal funding, which again speaks to the risks of federal retrenchment. Already is going to lower the total amount of services, although these are not all going to be in human services. The federal stimulus included substantial sort of unrestricted aid to local governments, as well as aid to things like education, which will not be picked up in the federal funds tracker. So all $9 billion of cuts won't be to human services, although certainly we're already seeing some federal retrenchment at the trickle down to the local governments. And so the executive budget deals with this a couple of ways. I mean, some of these COVID programs, like higher level of testing and epidemiology, we're estimating we're just going to need less money for them as the pandemic eases. And then the mayor proposed a $1.3 billion program to eliminate the gap, or PEG. Overwhelmingly, the savings, this $1.3 billion in savings, is from expense re-estimates or vacancy reduction, meaning that the city government thinks that it can provide the same level of services for less money than they initially estimated, and that they can simply go without staffing lines that are currently not filled. So it's largely these kinds of savings, rather than there are no layoffs of people who are currently employed, and relatively few actual service reductions, which are euphemized as efficiencies in the PEG program. So the mayor's budget proposals really focus on public safety, including funds to implement his anti-gun violence blueprint, childcare and youth services, including funding for the summer youth employment program, and funding for mental health and homelessness, including adding 1,400 stabilization and safe haven beds. And then as the mayor released his executive budget, the council released its list of priorities. In some fields, these priorities seem to already align with the mayor's priorities, especially around youth services, where they identify a range of youth services they want fully funded, including the summer youth employment program. And they also focus on education, mental health, and community safety. And then other items of note for human services is the city requested, or the city council requested $10 million for community organizations and HRA to increase access to benefits. So not expanding the depth or scope of benefits, but making sure that people are able to access all the benefits for which they're eligible, as well as a 4% cost of living adjustment for human services workers. Since this isn't an official council response, this is just their priorities, there's not as much detail as we might want, but these are the priorities that they've flagged at this stage. We still have a ways to go before we get a city budget, which is due at the end of June. And then lastly, we'll take on the federal government. So the federal budget isn't due until October, but at the end of March, President Biden released his 2023 executive budget proposal. The proposal contains a 12% increase in non-defense spending, but the biggest single increase is for veterans' health care, which, since it's administered directly by the federal government, really isn't picked up by city or state human services funding. But there's still several major items of note for local human services. One major one to flag is they budget a decrease in Medicaid spending. And this is not a decrease in spending for to try to reduce service. It's that they're projecting a decrease in total Medicaid enrollment as the economy recovers. So this is another one of those sort of major risks that I flagged earlier, right? They're expecting that the recovery will proceed well and people will have less need for Medicaid, their incomes will go up. You know, to the extent that that's not the case, that really runs the risk of leaving state and local governments with inadequate federal funding to cover elevated Medicaid enrollment, and having to sort of be faced with the debate of finding further money to cover those gaps, or you know, worst case, cutting services. So other items of note in President Biden's executive budget proposal are a new program, a new mental health transformation fund, which wants $7.5 billion, which would include funding for community health centers to deliver mental health services. And then in this table, I've flagged several areas, several programs that would see substantial increases for human services. This is not an exhaustive list, but this is sort of, these represent the human services programs that would stand to gain the most money from if the president's budget proposal were implemented as it's currently worded. And so these are the Child Care and Development Block Grant, Head Start, the Community Development Block Grant. Section 8 housing vouchers are really the most substantial increase, you know, for $4.8 billion, which would include a pretty enormous increase in the number of people who would, or the number of vouchers that would be available to city agencies to hand out. Since it's not an entitlement, obviously the demand for these currently, you know, vastly exceeds the supply for them in New York City. And then additional funding for homelessness assistance grants. What's important to note here is that none of this is inevitable. Unlike at the state and local level, you know, the state and local level can kind of kick the can down the road a few weeks if they're a little bit late to the budget, which is somewhat common for them to do, you know, a week or two. With the federal government, it's not at all uncommon for them to kick the can down the road for months, or just not pass a budget and run the government via continuing resolutions if they can't agree on anything. So, you know, the message here is that unlike the local level, this is none of these proposals are even remotely inevitable. So, but these are something that we will continue to keep our eye on and report on as negotiations proceed. So that's the bulk of it. If we have any questions. You know, this was a lot of content. I have a lot. I tried to summarize it. I have a lot more data, obviously in the report and the op-ed, which I would be happy to share or provide anyone data if they want to email me, or if they're curious about the federal fundings tracker. And then people are also welcome to enter any questions in the chat. I do see a question here. What's the best way to digest this information and what it means for my organization is a great question. So the federal funds tracker does have a tool called the Federal Budget Analyzer, which we can share. We can send a link to it in the after the this presentation. And it's actually a tool that does allow FPWA member orgs to figure out what they benefit, what grants program they benefit from, and then how various budget proposals would how that funding would change under various budget proposals. And then for each grant, for each organization or organizations that might not be included in that, if this is something that I'm happy to help you with if you want to email me directly. But even in our report, we have data on sort of the full scope of human services grant programs. So if your organization receives federal grant programs, you of course know which ones are sort of which ones you're receiving the most funding from. In our report, you can look into these and sort of see the trends for them, and then as different as we get competing congressional budget proposals, we will continue to sort of update those, and you can see for each congressional budget proposal how funding would change for different human services grant programs that you might be receiving. So right now we don't have one for the current year because there are no congressional budget proposals yet. It's too early in the budget cycle. But as the budget cycle moves on, we will update this, and we'll send this out to our mailing list, and sort of highlight which programs stand to gain and lose, and how funding will change for each of those programs under different budget proposals that come out of Congress. Yolanda has a question. Is it fair to say it's most useful for organizations receiving federal funding? That's a great question. Right now, the federal funds tracker, yes, absolutely, it's useful for organizations receiving federal funding because it's sort of only built to look at federal funding. One of the things that the FPWA's policy team is working on is actually expanding this out to be able to track track not just federal funding, but human services funding at the state and city level. So sort of an all-inclusive or more holistic tracker of human services funding and how it pulls from different sources. So if your organization receives sort of non-federal funding, I think our updated tracker, which we will be providing information on in the coming months, will be more useful for you. Right now, the federal funds tracker, yeah, I would say is most relevant if you have federal funding.
Andrew, before we jump off, did you see the last question come through? For anyone who's...
Let me take a look here.
City, state, and federal COLA for human service workers would trickle down to CBOs?
Okay, sure. Great question. So how the COLA works is in the language that was passed in the state budget, they basically give you a pretty clear definition of who would benefit So it is any workers who have a contract from OTDA, State Health Department, and then they give sort of primarily OTDA in the State Health Department, and then they give a list of other sort of contract services that are included or exempt from it. So in general, if you have a state contract, I could go through the language, and if you have sort of a specific question about who's exempt and who's included, I'd be happy to help. But yeah, you really have to be contracted from as part of one of the state programs. The city program, it was in the council priorities, but it wasn't legislative text, so we can't see very clearly who would benefit from that 4% COLA proposed by the city council, just because it was one bullet point. It's not legislative text yet. The way that the 5.4% state COLA, we should have a pretty clear understanding of who benefits from that. So in terms of your CBO or any given CBO, it would depend exactly on what contracts and sort of where that money trickles down from. And then the federal, I don't believe that there was specific language for a COLA, although I think that some of the increased funding for the programs I identified could be used for higher wages. But yeah, my answer is that for the city side, we're going to have to probably wait until we get a little bit more detailed legislative language to figure out exactly how that works and how that would intersect with the state, right? Whether that would, their 4% would sort of be layered on top of the state's 5% or include workers who are not covered by it, remains to be seen. All right, well, I'm not seeing more questions. So unless anyone has any last minute questions, I think we will wrap up. I'd like to thank everybody for joining and thank Adia for putting this on and Raysa for giving us the introduction. I would encourage everybody to join the subsequent two panel discussions in the May series, which Adia introduced. Yeah, unless anyone else has anything, thank you for joining.